Are bed sores on a dying person a sign of neglect? If you're new to my page, hi, I'm Hospice Nurse Penny. I'm a certified hospice and palliative care nurse, and I want to help you to understand what's normal about the dying process so you know what to expect when your person is dying. So do bed sores on a dying person mean they're being neglected? Not necessarily. Bed sores are caused by skin breakdown, usually for people who have fragile skin and who are immobile, such as somebody who is in a wheelchair a lot or are bedbound. The way that we prevent skin breakdown for people like that is to reposition them often. So for a person who's not dying, bed sores can indicate neglect, but for somebody who's dying, there are some other complications. Our skin is an organ. It's the biggest organ in our body. When somebody is dying, their organs begin to fail, and that includes the skin. Add to that, you have a person who isn't really moving around very much anymore, so they're going to have areas that are getting more pressure on them, and that will contribute to skin breakdown and ultimately could cause wounds. In order to heal the wounds, a person has to have a good nutritional status. Somebody who is dying isn't really eating anymore, and so they aren't getting the nutrition that they need to heal those wounds. One of the wounds we see fairly often in a dying person is called a Kennedy ulcer, which is a bed sore that is so big and so deep that we can see muscle, bone, tendon. It's like the skin is literally just melting away. Unfortunately, there's not a whole lot that we can do about bed sores on a dying person. We just try to keep the odor down and manage the pain as good as we possibly can. We know you're doing your best to take care of your dying person. Sometimes skin breakdown is unavoidable. If you're seeing reddened or opened areas, make sure that you tell your hospice nurse about them. Nobody is going to judge you or think that you're neglecting your person.